My name is Debbie Toney. I'm a registered nurse and a certified neuro-registered nurse here in the neuro-intensive care at CAMC. Pretty much all the sciences you can get: biology, anatomy and physiology, chemistry, and math classes, which are very important because when you get into drug calculations and things like that, Algebra 1, Algebra 2, I think that's all that I took, and I felt pretty well prepared. Well, I became a nurse. I kind of grew up in a somewhat medical household. My mom had worked here at the General for many years, but what really I feel brought me into nursing was I had scoliosis, which is curvature of the spine, which they screen for in schools now as a child, and it was pretty severe. So I was hospitalized several times, and I was in body cast, and then I ended up having like a big surgery. And when I had my surgery, I had the most wonderful student nurse, and what was so cool about it is she said, "Well, I've had scoliosis too." And I looked at her and I thought, wow, you know, that was like my angel of mercy. You know, I thought, well, if she can get through it and, you know, look this good, and, you know, and that, oh, I was hooked. I was hooked from then on. I knew that that's what I was supposed to be. We do neuro checks, which is like a neuro assessment every hour. We chart their vital signs every hour. For the neuro vital signs, we look at things like their level of consciousness. Are they alert? Are they confused? Are they moving all their arms and legs equally? You know, is their conversation appropriate? Things like that. And that kind of gives us a good key as to what's, you know, going on in the brain. Taking care of patients and interacting with them and their families. You know, especially in an intensive care unit, you really are with these families at a time, probably one of the worst times of their lives. And just being able to help them get through that, comfort them and educate them about what to expect, and it's so meaningful. It's hard work up here, but when you take care of patients that have had head injuries or spinal cord injuries, and you just, you know, sometimes they're not the same person that they were when they came in, and it's just, you have to have a lot of patience. But I do work with wonderful nurses. We have just wonderful colleagues. We work with incredible physicians that I still am just amazed at, even after being a nurse for 30 years. It's just, it's wonderful to work with them, the neurosurgeons and neurologists, the intensivists, the critical care doctors that take care of all the medical problems for us, whereas the neurosurgeons will take care of their part. So, and I do, it's just, I think I'm meant to be here. Being a nurse is a wonderful career. I mean, I have never been happier. And I'd like to say that when you are a nurse, you really don't know the impact that you have on patients and families. Because I have a patient's family that writes to me that I took care of like 15 years ago. And, you know, you just don't know. And even if that family doesn't tell you, you know, you really helped me through this, you meant a lot to me today, you will never be forgotten. So it's a good legacy to have. When you have a patient that you know is not going to survive, how do you get a family through that and comfort them through that horrible time? You know, they're losing a loved one, you know, and you feel so helpless almost. So just trying to help get them through that period, comfort them. You know, we use our chaplain services a lot here, and we appreciate that so much. But I think that's probably the most challenging, because nobody wants to lose a patient. Well, for me, since I'm the charge nurse here in the Neuro ICU, we'll come in, make assignments, you know, tell nurses which patients are going to take care of. I get report from the night shift nurse, and then I get a detailed report on every patient, and then we round on all the patients. We actually go in the rooms and look at the patients and the drips they're on and the machinery, and talk with families if they're there. Then I do things like help the nurses with their patients if we've got procedures going on, which we usually do. I help with those. We transport patients to a lot of times the CT scanner, the CAT scanner is a frequent place that we go many times a day. Make rounds with physicians, those type things, and just kind of keep everything hopefully going and organized and, you know, on a good path for the day. I have been lucky enough to have been involved in a program called Think First that is sponsored by the neurosurgeons and CAMC. And we would go into the schools and we do try to help the students find ways to have creative problem solving, so that if they do, you know, they get in an argument with somebody, for example, and to keep it from escalating, what are some tactics or some strategies you can use to, you know, resolve that without it escalating to violent behavior. With these programs, and it's really cool because we have the elementary school level, the middle school level, and the high school level, and we hope it's effective. I think it is, but it's interesting that we start at that young age because we hope that by the time, you know, they do get to school and high school, that those kind of creative problem-solving abilities are well established, and that's going to be their first line of defense, as opposed to physical violence or verbal abuse, those type things. So it's a really good program. I've loved, you know, being involved in it. That patient that I'm taking care of today, lying in this bed, could very well be them. You know, you have to make good, responsible decisions, whether it be regarding violence or drinking and driving or drugs and driving. You just don't know when things are going to change. And I mean, especially in our area, in the neurosciences, you get a brain injury or spinal cord injury, and trust me, your life will be changed forever. You will not be the same kid that was, you know, going to school every day. It totally changes. So we just hope that you know, you listen to this message. We don't want you to wind up in one of these beds. You know, it's just sad and it's senseless.